Alright, to begin this assessment, I'm going to start by performing hand hygiene using some hand sanitizer. I'm going to be wiping down my stethoscope with an alcohol wipe, and I'm going to be donning some gloves. Hi, my name's Tina, and I'm going to be your student nurse doing your assessment today. We're going to be focusing on your ears, nose, mouth, throat, as well as your upper extremities and your lungs. I'm going to be touching you in some of those areas. Is that okay?
Yes.
And before we begin, do you need to use the washroom?
No.
Alright, I'm going to be providing the patient with some privacy. So can I have your first name?
Dan.
And your age?
55.
And I'm going to be asking you some questions about your symptoms. So first, do you smoke?
No.
Do you have a history of sore throats?
Yes.
Do any positions worsen your shortness of breath?
And I'm lying down.
Lying down, okay. Do you have any chest pains?
No.
No chest pains? And how long has your ear pain lasted for?
A couple days.
Okay, so we're going to be in the assessment now with the ears. So first I'm just going to inspect. The ears are symmetrical, and I did not see any cerumen or discharge. I'm going to be palpating first the tragus. Is there any pain?
No.
And now the auricle I'm going to pull up and back. Is there any pain?
Yes.
A little bit of pain? Okay, and now I'm going to be doing the whisper test. So first I'm just going to be pressing the tragus on the ear. I'm not testing. So
T1, K2, G3.
perfect. And I'm going to do the other ear.
A2, B4, C6.
Perfect. So the patient did get all of the combinations of the numbers and letters correct. So now we can go on to the nose. So just by inspecting the nose is midline in the face, and I do not see any crusting or discharge in or around the nostrils. I'm going to be palpating the axillary sinuses. Is there any pain?
No.
And now the maxillary sinuses. Is there any pain?
No.
All right. So now we can continue to the mouth. So I have my tongue depressor and my pen light. So just by looking at the lips, I see that they are a pinkish red color, which is normal, and there are no cracking or crusting on the lips. Can you open your mouth? And first I'm just going to be assessing the gums. They are a light pink color, which is normal, and I do not see any lesions. As well as with the teeth, they are all intact with no signs of caries or looseness. Can you stick out your tongue? Alright, and can you hit your tongue to your top lip? So the tongue is a pinkish color, which is normal. And there is saliva at the base of the tongue, which is normal, and there's also veins. And now can you stick out your tongue and say ah? Alright, perfect. So while the patient was doing that, I was testing for cranial nerves 9 and 10, which is the glossopharyngeal and the vagus nerve. And since the patient, when the patient said ah, their soft palate rose, which is normal. As well as the color of the soft palate is pink, and the color of the hard palate is white, which are both normal, and there were no lesions that I could see. And can you just stick out your tongue and move it side to side? And say light, tight, and dynamite.
Light, tight, and dynamite.
Alright, while the patient was doing this, I was testing for cranial nerve 12, which is hypoglossal, and they could move their tongue side to side with no tremors and say the words without any problems, which is good. And so now we can move on to the neck. So I'm just going to inspect and palpate. So upon inspection, I see that the skin color is all one tone. There is no engorgements of the thyroid, and I cannot see any edema. I'm just going to test the temperature. So the skin temperature is warm on both sides, which is normal. Is there any pain?
A little bit.
Yeah, I did notice a little bit of tenderness and pain, and again, I could not see or feel any masses. Alright, so now I'm just going to check the carotid artery, and I'm going to do one side at a time. Alright, perfect. And normally I would assess for 30 seconds and then take that number multiplied by 2. I got a rate of 80 beats per minute. It was a 2+, which is normal, and the rhythm was normal. And now I'm just going to be assessing cranial nerve 11, which is spinal accessory. So can you move your head that way? Okay, and move your head that way. And then now try to put your shoulders up. Perfect. So the patient could do this with ease, even against my force. So I would rate them a 4 out of 5 for musculoskeletal strength. And then moving on, we can go to the upper extremities. So first I'm just going to inspect. So the upper extremities, the skin color seems to be all one color. I cannot see any edema, any scars or lesions. Now I'm just going to palpate and check the temperature. So the temperature is warm on both sides, which is normal. I did not feel any edema. Was there any tenderness or pain? No, and I could not feel any lesions or masses. I'm just going to check. So the nail beds are pink, which is normal. The capillary refill is 1 second, which is in the normal range. And so now I'm just going to be doing some range of motion tests. So just copy me. So we have flexion and extension of the fingers, flexion and extension of the wrist, radial and ulnar deviation, flexion and extension of the elbows, supination and pronation of the elbows, then abduction and adduction of the shoulders, and then external and internal rotation of the shoulders. So did you have any pain while doing this?
Yes.
A little bit of pain. So the patient did have pain, and I could also see that there was a limited and altered range of motion. Now I'm just going to be palpating first for the radial pulses. So again, normally I would do 30 seconds and I would multiply the number by 2, but I got 80 beats per minute, which is normal. It was a score of 2+, which is normal, and the rate and the rhythm was normal. And now the brachial pulses. Again, I would be doing this for 30 seconds, but it was 80 beats per minute, a score of 2+, and a normal rhythm and rate. And lastly, can you just squeeze my fingers? All right, perfect. So the patient's strength was pretty good when they squeezed my fingers, and bilaterally the strength was even. And now I'm just going to be moving on to the chest. So could you just turn this way? No, the other way. All right. So first, I'm just going to be doing an inspection. So, and normally the patient's shirt would be off. This is a disclaimer, but for the purpose of this video, the patient is going to keep their shirt on. So just an inspection. The color looks good. I don't see any masses or lesions. The spine does look midline and straight up. I'm just going to be palpating and temperature. All right, so the temperature was warm and even throughout the back. I could not feel any edema. Was there any pain? No. Okay, I did not feel any pain as well, and I could not see any masses. Can you just lift this arm out? All right. So this is the anterior posterior length, and sorry, could you turn around again? And this is the transverse length. So the patient has an APT ratio of 1:2, which is normal. You turn back. And now I'm just going to be percussing for resonance and all 9 areas. All right, so while I was percussing for resonance, it was a low pitch, which is hollow, and the sound was, it was a low pitch sound. It was hollow and clear, which is all normal. And now I'm just going to be auscultating for breath sounds. And I'm going to be doing this again in all 9 spots of the posterior thorax. So while I'm doing this, can you just take some deep breaths? So I'm starting at the left upper lobe, going to the right upper lobe. The right lower lobe, left lower lobe. All right, so while I was taking the patient's breath sounds, I noticed their respiratory rate was 20 breaths per minute, which is normal, but it is on the high end. Their breath sounds were rapid and shallow, as well as there were some adventitious sounds, such as wheezing. And that concludes the end.